The latest round of federal cuts is hitting the healthcare system now. The U.S. Health Department announced today it plans to cut 10,000 jobs, just days after cutting $12 billion in funding to state health grants. WCNC Charlotte's Julie Kay is in studio. Julie, you confirmed this is going to impact North Carolina.
Yeah, Colin, I spoke with the interim state health director. She told me they're losing $100 million and having to cut 80 jobs. This is on top of slashes to other local health programs and potentially ahead of one to Medicaid.
Funding cuts from the top down and all the way back up. The Trump administration clearing out what they say is wasteful spending in federal and state health organizations. At the North Carolina Department of Health and Human Services, that's at least $100 million.
People are right to be concerned about continued access to services and really just ensuring we have the systems in place to work for North Carolinians.
Many of these funds were allocated during the COVID-19 pandemic, but Interim State Health Director Dr. Kelly Kimple says they address a range of issues, including immunization efforts, infectious disease monitoring, and behavioral health.
It highlighted a lot of gaps in our public health infrastructure. And so that really expands the use of the funding. And so this is much broader.
This hitting a system experts say is already spread too thin.
Anytime we're talking about any reduction, that just means a reduction in services.
Nick Riggs is the director of the North Carolina Navigator Consortium, helping people find the right health care coverage. They've already had their funding cut 90%, and he says anything on top of that puts a huge strain on the system.
If they can't go to us or the state, oftentimes they don't have a place to go. There's either a long wait time or there's just folks who we just can't help.
More cuts are still looming. Congress is considering a budget that slashes Medicaid. State Medicaid Secretary Jay Ludlam warning earlier this week that would impact 640,000 North Carolinians.
Local legislators have expressed really no option other than what we have currently. So there is no plan, no backup plan.
In 2023, North Carolina expanded Medicaid to people making up to 138% of the poverty level. However, if the feds can't keep holding up 90% of the cost, those people will no longer be eligible. While a final decision is up in the air,
the ripple effect is huge.
Providers are getting ahead while they can.
Now, House Speaker Mike Johnson wants to pass a real budget before the Easter recess, giving them only 3 weeks to decide on Medicaid. Colin, back to you.
All right, Julie, thank you so much.